Welcome everyone who's joined us already. We're going to give us another minute as people are joining. This is the informational town hall about COVID-19 and the status of Lehigh campus. So don't go anywhere. We'll give us another minute for more people to log on and then we'll kick it off. Okay, looks like the participant number is still climbing, but more slowly. So why don't we go ahead and get started? I am Chris Halladay. I'm the Associate Vice President for Human Resources here at Lehigh University. And today I am being joined by members of our COVID-19 response team. And they're going to talk specifically about the current status of COVID-19 at Lehigh, as well as our strategies and expectations for this semester that we're just starting. There will be, this is how it's going to look. We're going to start out with kind of an overview from our Provost, and then we will also have some time to talk with our panel, fielding some questions that have been turned in already. We'll try and save some time at the end to answer questions that come in as we're discussing things. You'll see at the bottom, there's going to be a little Q&A button. If you have a question that you want to put in, please enter it in there and we will answer as many as we can. No promise that we'll get to all of them, but it will be recorded. So if you do have to drop off early, or if someone asked you what was said and you can't remember it word for word, this will be posted as a recorded session on the COVID information website for Lehigh University. Okay, joining us then, our panelists today are our Provost and Senior Vice President for Academic Affairs, Dr. Nathan Urban. Also joining him is Rick Hall, our Vice President for Student Affairs, David Rubenstein, the Executive Director of the Health and Wellness Center, and Sarah Stevens, the Medical Director of the Student Health and Wellness Center. All right, so I'm going to start this off, Nathan, by turning the time over to you. If you can just give us a little update, what is the current status on campus?
Sure, thanks Chris, and thanks everybody for joining. So currently, the day 2 of the second week of the spring semester, we have 158 active cases on campus, which is a big number. This represents a 2.63% positivity rate averaged across all of the pre-arrival and on-arrival testing. However, that positivity rate has been going up in recent days, which is a source of significant concern, and I'll talk about some of the responses to that in a few minutes. So with respect to taking a little bit of a step back and looking at the spring semester overall, there are a number of things that have been changed for the spring semester. One is that the testing has been significantly ramped up, so that we have had pre-arrival testing. We are now in the second round of arrival testing for all students who are accessing campus, and even students who are fully remote but in the Bethlehem area. And so we will this week test another more than 3,000, probably more than 3,000 students overall who are part of that population. So we will have a much more day-by-day fine-grained ability to look at the positivity rate, the numbers of students who are testing positive, and then we will be able to respond to that with contact tracing and all of the follow-up, isolation, quarantine quickly thereafter. We have significantly increased the number of people who are trained to do contact tracing and who are volunteering to do this, as well, in addition to and correspondence with the increase in testing. We're also trying a couple of different approaches in terms of improving communication to campus, this webinar being one, or town hall. We're also, the CRT is meeting weekly with representatives of undergraduate and graduate student senates, faculty senate, and ERAC to discuss concerns or issues that are arising. We've updated and improved our COVID dashboard that is available, that is updated daily. And we've also created a web page that describes the current status of campus to try and avoid confusion about exactly what's open, what's closed, what's allowed, what's not allowed. So that all of that has been put in place for the spring and either created a new or improved compared to the fall. As I said, in the last few days, we've grown concerned about the positivity rate and the increasing positivity rate. In the pre-arrival testing, that positivity rate was on the order of 1.5% or so. Late last week, it was trending towards more like 2.5%, and even a little bit higher. Testing from the tests that were conducted on Friday alone, as shown on the dashboard, is greater than 9%. And so that is a very significant concern for us that as we're looking forward. Yeah, the good news is that we understand a lot more about the virus and about COVID and how it is that it's transmitted. In some sense, the good news is that we know what works. We just have to make sure that we're all doing it. We know that it works if we wear masks, and if we, another thing that is absolutely critical is to avoid large gatherings. Just to give you a bit of an example, if the positivity rate is 3%, and you're in a gathering where you would be considered close contacts with 50 people, then there's an 80% chance that you have been in close contact with somebody who has COVID. So even if the positivity rate overall seems low, like 2 or 3%, if you interact with a large number of people, then the likelihood that you've been in contact, not to say that you'll necessarily contract COVID, but the likelihood that you've been in contact with somebody who has COVID becomes high when you interact with large numbers of people. So because of the increasing positivity rate and our concerns about that, we have reversed our planned shift to in-person dining for the semester, because we know that of all the activities that and the risks associated with them, in-person dining, eating together because you can't wear a mask when you're eating, that's something that is a significant risk factor. We are continuing to look at other activities that we believe are among those that cause the greatest risk. But I would say that for us, most of what we're looking at in terms of risk is social gatherings, and that is our single biggest concern. We certainly hope that if we can reverse the current trends and get the positivity rate to be down, that we can shift to a more open, more active, more in-person activity on campus, including opening of the gym, more in-person social activities. And we are looking and trying to plan for options for potential for in-person graduation by the end of the semester. But all of that shift towards a more open, more in-person campus depends on our ability to reduce the positivity rate. Depends on everybody avoiding the things that we know put you at risk, put the community at risk for COVID. So with that, I'll turn it back over to Chris, and we can shift to some of the questions that have come. Thanks.
Great. Yeah, thank you, Nathan. It's a good overview. Let's go ahead and start with some of the questions, and these will be open to all the panelists, but I think some of them will be directed, more specifically, obviously. And just to let those who are participating know, these are questions that were sent in ahead of time. There was quite a few, so we're trying to focus on those that were sent in that were either duplicates or the same type of theme that was repeated several times. So Rick Hall, Vice President for Student Affairs, let me start with one that I think is probably aimed at you. So Nathan talked about, we have certain precautions in place, but how is the university enforcing those precautions, and how are we ensuring compliance?
Sure, thanks, Chris. Very similar to last semester, the university addresses any and all reports that come in, either anonymously or attributed to an individual. With regard, and I know that we received a number of questions with regard to off-campus parties and socializing, and the response, especially through student conduct, means the violation has already occurred. It's important that in real time the behaviors are addressed, and that's either by other students, other staff, sometimes by the police. Each and every reported instance of health and safety violations are addressed. Right now, I believe there are about 25 COVID-related conduct cases pending and a few involving student organizations. And earlier this semester, to all students, there was communicated that there are increased or more severe sanctions for COVID-related violations. At this point in the academic year, none of what's being asked of all of us is new. So we know that we should be social distance. We know that we should be wearing masks. We know that we shouldn't be having large gatherings. So the sanctions for violations, again, have been increased in severity.
So, and you know, we hear about some of these infractions, but doesn't it seem at times like we're restricting everybody when it's just a few people who are breaking the rules?
Mhm. And well, and again, there are community expectations. So the restrictions are on all of us. With regard to, and we use parties as an example, none of us should be having parties, large parties. We know that there were some gatherings around the Super Bowl, or on the weekends, folks will get together. As I leave campus some days, I do see gatherings on porches and some of the neighboring properties right back by campus. But those are the exact same expectations that are in place for the Bethlehem community that's just adjacent to campus. And so it's not restricted or intended to be heavy-handed towards any specific population. We all have the exact same expectations in front of us.
And what are some of those restrictions right now? Right? Is there a number of like up to 5 people? Are we in total lockdown right now?
No, and again, it's five individuals for small social gatherings. We know that right now, I'm looking out the window now, it's snowing, so we know that there's going to be limits on outdoor activities. So we're really looking at indoor gatherings. They should be five persons or less. We've been encouraging students to make requests for use of space. We have plenty of empty spaces on campus in which students can safely gather. I just learned from our Vice President for Equity and Community that the lounge spaces on the second floor of the University Center, those are going to be opened and available for students to socialize or to study or to just be in there between classes. I know that some students have already used the Girdler Gallery on the first floor of the University Center, but we look now for the M Room and the Pride Center and the Center for Gender Equity to also be opening up in the upcoming days and weeks. There's also space in Williams Hall. I know I've seen students in the Global Commons area, in the Arboretum, any spaces on campus that can be accessed by card access are available for students. And these spaces, they're already taped off. We have safety measures in place. The cleaning staffs are in the buildings during the days as they have been throughout the pandemic. So we just ask students to explore different uses of spaces on campus, and we'll do the same.
Okay. And maybe just as a reminder for people, on the COVID information website, there is a campus status page that you can go to as these things change. And there's developments all the time. So Rick, perhaps, what does this mean for the Greek organizations? Right now is usually a pretty active recruiting time.
And well, and it should be said that especially the Greek leadership, they worked daily for hours upon hours with our Office of Fraternity and Sorority Affairs last semester to devise a plan for Greek recruitment that was safe and but it would require all of the organizations to uphold the standards, the agreed upon standards. And they all did. Each organization, each council also has a national plan. So the national offices have virtual plans for recruitment that were communicated to the university and agreed upon. And we also know from last semester that our students are craving interaction, involvement, and community. And Greek life is just one way to help build community. So we wanted to, and we are giving it a shot. We started the semester off with sorority Panelists recruitment. We've recently started IFC fraternity recruitment, and it is intended to be completely virtual, at least to begin. We've received some reports that this has not been happening across the board. And again, those instances will be addressed promptly by the Office of Student Conduct.
Very good. What kind of impact will it have on athletics?
And it depends, but a similar impact. Athletics, they are doing a rigorous, or they have a rigorous testing model in place. They do contact tracing within athletics, and the decisions are quickly made to shut it down, practices and competition, upon finding out about positive cases within athletics. So it's very similar, and similar to what other universities are experiencing that are having active athletics.
So let's take that then. We know that that's a situation right now. How might things change, and when might things change? I'm going to open this up to the entire panel. Anybody's willing to venture a guess on when things might change, but for example, what would need to happen before we can open up dining or change some of these restrictions? David, Sarah, feel free to weigh in, or Nathan.
We would need to begin to see some reversing trends in some of the things that we've been seeing over the course of the last week and a half in terms of the surveillance, daily surveillance testing that's happening. It's still trending upwards. So we would need to see some reverse in those kinds of trends. And we're also seeing increasing cases in the Health and Wellness Center of students who come into the Health and Wellness Center who are symptomatic and who are subsequently testing positive. So I think some of the things that we would really need to see is some reversing in some of those trends on the surveillance testing as well as the symptomatic testing.
To give a little bit of sense of what we would be looking for, and there are many factors that go into these decisions, including surveillance test positivity rate, the symptomatic positivity rate, capacity in isolation spaces and quarantine spaces, et cetera. But the kind of thing that we would be looking for in terms of good news, or at least much better news with respect to the number that people pay a lot of attention to, which is the positivity rate. That number above 2% is begins to get worrisome. Something closer to 1%, that's a number that is more manageable in terms of the likelihood that in-person activities would be safe to do. And again, this is based on thinking about the numbers of interactions and numbers of people in a group. And so those are the kinds of things that we're looking at. The early rounds of surveillance testing and the pre-arrival testing, we were again between 1% and 2.5%. Those were numbers that were making us optimistic about being able to expand activity on campus. But the more recent numbers are concerning.
So should we hold out any expectation then that sometime during the semester we will see a relaxing of some of these, for example, with dining or the gym or club sports or anything like that?
We certainly want to make campus as open as it can be, as long as it can be done safely. And so, we're enthusiastic about trying to reverse some of these restrictions and to make it possible for students to do some of these activities, both educationally, socially, et cetera. And so I think that we want to be moving in that direction, but we can't do it the kind of positivity rates that we're trending toward.
As Rick was saying earlier, it's balancing, it's having the other side of the balance. So at the same time, we're opening up, trying to identify spaces, have them available for students to congregate safely and to connect and to have those opportunities for social and emotional connectedness, which is so key to health and wellness and well-being. So it's trying to hold both of those at the same time and keeping the campus safe.
Okay, very good. Is there a risk it might go the other direction? So we're starting on-campus classes, Is there a chance that we might have to go to all fully remote, fully online again with those?
So certainly we're looking at all possibilities. We, based on our own data and based on data from campuses across the country, we believe that in-person classroom activity is generally quite safe. And so which is why it is that we have, well, both because we believe it's safe and because of the educational value, we prioritized keeping in-person classes in person. But certainly there will be, that's something that we will continue to look at, both with respect to any evidence of cases that are linked to in-person classes, but also just with respect to the positivity rates and other factors that may mean that activity is at greater risk than what we had thought of before.
And if I'm still nervous about coming into class, can you tell us a little bit about the safety precautions we are taking? Particularly if I have classes that really can't be done virtually or very difficult to do remotely.
Yeah, so I mean, we have dramatically reduced the density of people in spaces, and so the spaces where classes are being done are 3 and 4 times larger than they would have been for the number of people who are gathering in those classes. We've also, in a number of cases, installed physical separation, plexiglass screens, sheets, et cetera, if there are circumstances where we feel like there's a risk of people who need to be or will be in closer contact in some way or another. And then obviously wearing a mask at all times is something that is one of the requirements. And I will say that in my own everyday life, I am now, if I'm doing something that seems a little bit riskier, I'm wearing 2 masks. And again, this is based on guidance that's coming from CDC and other places. A disposable surgical mask underneath a cloth face covering. That's something that has been sort of a renewed interest in the quality of masks. Is something that's come up recently, and that's something I think we can all pay attention to and respond to as well. So those are some things to think about and if anybody is concerned about a particular classroom environment, if you think that given the layout of the classroom or given something about that classroom, it is a higher risk activity, let us know. Send us an email. Send it to the incovid@lehigh.edu email address. We will look at that. We'll evaluate. We are trying to be responsive to make things safer. And so if there's a specific concern that people have about a particular classroom or a particular environment, let us know. We're happy to look at it.
Good, thank you. Research, sometimes that's difficult to do online. If things do get worse, could there be an impact on some of the research activities?
I mean, I would say it's always possible. So far, we have had no cases that have been linked to the research environment in terms of transmission. And that's true for us. It's also true generally in other universities across the country. If we can do the things that we need to do, this is why we repeat so often these guidance and recommendations about things like mask wearing and social distancing. There's so much evidence at this point that if we do those things, the likelihood of transmission is extremely low. And in the research environment, that's an environment where we haven't seen any evidence of transmission. And so even when there have been cases of people who are engaged in research in that environment, where they've acquired it somewhere off campus and come onto campus, there's been no transmission among individuals in their research groups to date. And so we are pretty comfortable with that. Now, that said, we are always, if the evidence changes, if the data changes, that's something that we look to change our guidelines and guidance.
And this is a big semester for a lot of seniors. Do we know when we're going to be able to make any decisions about commencement?
We've been looking at this and trying to understand when we would need to make those decisions in terms of people's travel and reservations and things like that. And we really probably certainly need to make a decision sometime in March. at least to begin to put things in place. And we're trying to do everything we can to create a situation where an in-person graduation can be done and can be done safely. And so we're looking at options and possibilities for that right now.
Good. Okay. Let's we can come back to some of those later. I think there's still some more questions around that, but let's also talk about testing. That's now becoming a part of every day, or at least every week, life here at Lehigh for most of our students. What is the testing strategy that we're pursuing right now?
So we are currently testing all students who are in the Bethlehem area. We've tested them pre-arrival, we tested them in the first week, and we've tested them in the second week. What we've committed to is that there will be at least testing of at least 50% of all students in that category each week. That number could be higher. If the case counts continue to be higher, then we will certainly maintain an elevated level of testing. But what we've committed to at a minimum is 50% of the student population per week.
And I hear some students who are going to the Health and Wellness Center to be tested as well. When should that happen?
David, do you want to take that?
Yes, certainly if any students are feeling concerned around having symptoms and they're not quite sure what those symptoms are all about, you absolutely want to reach out to the Health and Wellness Center, and one of the nurses or providers will guide you through a discussion about determining what the next best steps and talking about your own symptoms, the potential of being in close contact with somebody who tested positive. And then from there, we'll tell you specifically what needs to happen as far as coming in for testing, for if you're symptomatic, which is going to be rapid testing, we'll be able to get the test results the same day. Or if you're close contact, what we call tent testing, and it's also in Johnson Hall on the first floor. And we usually get the results of that back in about 48 hours. So one way or the other, if you're symptomatic and you contact us, we're going to try and get you in as soon as possible. And we'll do testing and get those results the same day. And if you're in close contact with somebody, we will also try and get you in as soon as possible, same day or the next, and get those results within 24 to 48 hours. So if you're not quite sure whether you're symptomatic, it's always better to err on the side of caution. Give us a call, and so we can spend some time talking with you. Sarah, I don't know if you want to add to that.
Yeah, the other piece I would add to that is if you're symptomatic, probably the most important thing you can do is stay home, stay in your living space. Don't go out, limit your interactions with people and assume, given the positivity rates that we're seeing, that you're positive until we can kind of do a test and sort of demonstrate otherwise. So again, I would say the most important thing if you have symptoms is to stay in place and work with us to figure out when we'll get you in for testing.
So let me ask some more questions about the testing. First of all, if I ever test positive, then I'm told that I don't need to be tested again for another 12 weeks. Why is that? If I'm immune, then that's great, right?
So current evidence and guidelines are after COVID infection, people appear to have really pretty good immunity, at least from that same strain, for in the range of 12 weeks or 90 days or 3 months. It's sort of splitting hairs for about 3 months. There is some evidence that it might be longer than that, but the current guidelines are that during that period of time, the rate of reinfection has been pretty low. That may be impacted by some of the variants that we hear about that are, well, started out around the world and really have arrived in the United States and in Pennsylvania. So during that time, the other issue is also that you can continue to have positive viral tests. So the common tests, the PCR tests, they don't determine whether the RNA that they're detecting is from an infectious virus or whether it's just the virus that's still there that can't be, causing infection. So people can continue to test positive on these viral tests for up to 12 weeks. We would retest somebody, say if they had a new significant exposure and very characteristic symptoms to make us think that this might be a reinfection, but we would likely be doing that with some guidance or assistance, probably with one of our infectious disease partners, because it is pretty uncommon in that 3-month period of time. But people still need to remember, we don't 100% know, can people still transmit the virus? So, okay, I have immunity, but could I, be infected, if you will, and kind of carry it home to somebody, or could I carry home a variant even though I'm not going to get sick? So I look at all of that and I say, even if you've had an infection, you still need to be careful. So it's not a complete free pass to go out and not worry about it. We don't have any change in protocol on campus that says if you've had COVID, you don't have to wear a mask or don't worry about washing your hands. We all still need to do all the same things.
Good. All right. So how safe is it to go get tested? What are the safety measures that we're taking in the Zollner Art Center, the testing center?
Yeah, actually, the Art Center is a really good place in terms of it has 8 air exchanges per hour, and the CDC recommendation are around 5 air exchanges per hour. So given the volume and the size of the Art Center, as well as how the Art Center is set up in terms of having students come in and get tested, and the spacing of the testing, and then the exiting of the building, all of those things have really mitigation of risk in mind, as well as just the volume and the size of the center. So it's a safe place for us to be doing that testing.
Good. That is good. I've been in there myself. It does look like it's set up pretty well. And how reliable is it? How accurate? So for example, we have one question that came in where a student went onto campus for a vault test. It came back positive. And then they went somewhere else and got a second test and that came back negative. Which one should they trust?
Maybe I can take this. So there are a number of different kinds of tests. I mean, broadly speaking, there are 3 kinds. There's the PCR test, which is what the vault test is. There are a set of other rapid genetic tests. There's an Abbott test. There's the Cepheid machine that we use in the Health and Wellness Center, and a few others that are detecting viral DNA, like the vault PCR test is, but which do it more rapidly and are less sensitive. There's less amplification of the original sort of DNA molecules that are present in the sample. There's a third class of tests, which are the antigen tests, which are not detecting viral DNA, but detecting viral protein. And those are the least sensitive of the tests. The antigen tests are typically rapid tests as well. There was a study done, it was in part with one of the professional sports leagues, where the antigen test, the rapid antigen tests, only detected about 32% of all COVID cases that were COVID positive samples that were detected by PCR. And so the rapid antigen tests are mostly recommended for use by people who are symptomatic, because people who are symptomatic tend to have higher viral loads, and so therefore the antigen test is more likely to detect positive. So the vault test that we're using is the most sensitive kind of test. It's a saliva-based test, which might be slightly less sensitive than some of the tests that involve sticking the swab up your nose and getting the sample that way. But it is a very sensitive test, and it is therefore not surprising that in some cases a subsequent test may turn up negative. In addition, the amount of virus that you're expressing, the amount of viral DNA that's present, will vary day by day. It tends to peak within 5 or 6 days after infection, and then slowly decrease. And so, the fact that you test positive one day and negative the next may mean that you're in this recovery phase where your body is mounting an immune response and is therefore preventing or limiting, reducing the amount of virus that's present. And so therefore it may be then below the sensitivity level of the test. The false positive rate on the PCR test is extremely low. Less than 1% false positive, more like 0.1% false positive are the estimates on the false positive rate. So if you get a positive on the PCR test, the PCR test is essentially 3 separate tests that are being run simultaneously for different parts of the viral DNA. And in order to be considered to be a positive, we have to identify 2 of those 3 segments of viral DNA. So that's another sort of built-in reason why it is that the false positive rate is so low. When sometimes you'll see a test result that is inconclusive. One way to get an inconclusive result is if only one of the 3 viral DNA fragments are detected. And so in that case, that test will be rerun. So just to give you an idea of the nature of the test and the sensitivity and the confidence that a positive is truly a positive.
That's good. There's a lot of technical information in there. So about the virus, let's keep going with that. Let's transition it over a little bit to the vaccinations. We're looking forward to that. So, well, first of all, some students are saying they're going to vaccinate or some schools are saying they're going to vaccinate all their students. Does Lehigh have any plans to do something like this?
So I will say that I would love to vaccinate as many students as we can, but clearly right now the vaccine there's not enough availability of vaccine. I would say that we do require vaccinations for students for other diseases, and going forward, we will certainly look at, I think there's a high likelihood that in the future, once the vaccine is widely available, we will require vaccination for COVID, just as we do for meningitis, measles, etc.
Yes, the current significant issues in Pennsylvania, and not unlike other states, is availability of vaccine. And actually, even in a conversation this morning with the Bethlehem Health Bureau, they are still, because of the expanded phase 1A group that they are vaccinating, they haven't even worked their way through that group of people. And I can't completely comment on the local health networks, but I think they are also continuing to work through the 1As. And students in university congregate settings would be a phase 1B. So, more to come, but I agree, as soon as we can get our students vaccinated, we certainly want to have that available. But, we have to, we're part of the larger state allocation issues.
So let's say though that sometime during the semester, I am able to get a vaccine. Do I still have to test?
So I can take that one. So the current guidance, and like everything else in COVID land, as I say, is subject to change and most certainly will. But currently, even if somebody's been vaccinated, it is not recommended really to change anything else. So they would still do surveillance, and keep in mind that the surveillance testing is a viral test and is testing for either genetic material or antigenic material. And that is not going to be falsely positive because somebody has been vaccinated. And people say, well, if I'm vaccinated, then kind of why did I bother if I still have to do testing and I'm still going to have to quarantine if I was a close contact? So there's a couple reasons. One is when you're vaccinated, you have just helped prevent you yourself from having serious illness or dying from COVID. Granted, our population is mostly young and mostly healthy and mostly not at as high risk for those problems. But certainly the people we can transmit it to are. But the other part of that is that it's part of a larger public health process where we're going to be working to achieve herd immunity, getting a significant proportion of the population vaccinated so that we can reduce the amount of COVID that is spreading in the community. So it's still very important even if we ourselves, having been vaccinated, still need to wear masks and be careful and quarantine if we're exposed, vaccination is still very important. And we'll learn more in time about the durability of that immunity and whether that prevents transmission, meaning can the person who's been vaccinated still transmit it to somebody, or does it prevent that? But we don't really know that yet.
So there is still, even now, lots of talk about quarantining and isolation. So we understand that there are a certain number of spaces on campus if someone needs to be isolated or quarantined. Are we at risk of those filling up? And if they do fill up, what are we going to do about that?
So far we have a number of different sort of approaches to this, but so far the isolation space, which is what we're using for students who are living on campus who test positive, so far we're in okay shape in that regard. We have Tremblay, we have some other facilities that we could expand into if necessary. So that I'm comfortable is the wrong word, but I think with respect to isolation space, we're in an okay place. But the more difficult situation has been and was in the fall quarantine space, where that number increases relatively rapidly when there's a couple of positive cases. And so we did include some guidance that if the quarantine space becomes close to capacity, we may require students who live within a certain distance of campus to quarantine at home as long as they're asymptomatic. So that is one of the steps that we could take if the quarantine space approaches capacity. There was a question in the chat about getting a test, if you are in quarantine, getting a test before going home. And I would just say that there's lots of availability of different sort of options for testing in the community. We're happy to sort of make that known to you if you are considering going home for quarantine and need a test. If you're a close contact, that testing is provided in the Health and Wellness Center. So if you've been determined through contact tracing to be a close contact, you'll get scheduled for a test through the Health and Wellness Center. And but if you want to go sort of on your own, there are a number of options sort of in the local community for testing at this point.
And students to that point need to recognize that if you were a close contact, even if you have a negative test, it might be negative today and tomorrow it might be positive, and you might develop symptoms anytime up to that 14-day window. So you just need to keep in mind that even if you have a negative test and you choose to go home, that you need to quarantine at home and keep yourself away from other family members and other people, because you can still up to day 14 develop symptoms and develop a positive test.
Good, that is important to know. So with all the quarantining and isolating that's going on, and I think David, you mentioned this before, Rick, you too, that does take a toll on mental health, social health. What do we need to know about that, and what can we do about that?
I think looking for opportunities for connectedness is really, really key. And as we were saying earlier, we're talking about opening up some places safely on campus that allow students to gather safely, because that social and emotional connectedness is so important in terms of well-being. I would say the Counseling Center is also offering many different types of programs and workshops, and you should definitely check out the Counseling Center website. They have a lot of things that are going on this that are aimed at really helping students to connect with each other in a meaningful kind of way. The HAPS program is another office, whose website you should check. They just came out with a brand new app that called Headspace. And on that are a number of different stress management and mindfulness approaches to managing stress. It's free. And also within HAPS, there's a lot of other programming as well to get connected in ways that are safe. So I think really thinking about opportunities for social and emotional connectedness is key in all of this. And I think the other thing too, of course, and really when you're thinking about spending time together, one of the things that we're seeing in the Health and Wellness Center is it's a small social gathering that are allowing for spread of the virus. And so even when you're getting together in small groups under 5, keep your space, keep your distance, wear face coverings. Those are the things that really mitigate risk. And I know it sounds and feels odd, but those things mitigate risk. What we're seeing in the Health and Wellness Center is spread of the virus that is happening with small gatherings. So get together for sure, but do it safely and in small groups, under 5. Keep the distance, wear the face coverings, keep each other and yourselves safe.
Chris, and I would add, we know that all students are not going to have a relationship with the counseling center. It is, though, important that we check in with each other, that staff are checking in with students, that faculty are checking in, and students don't suffer in silence. If you're not doing okay, just reach out to the Dean of Students office, reach out to your faculty members. If you think you need just a break or you need some additional time or you're dealing with something family related, let folks know. We have plenty of resources in place, and I've been seeing the questions come in around mental health and wellness. We are, well, and I just wrote a note here, expect a town hall in the next several days specifically on mental wellness. And we'll get the folks together who should participate that can provide some good guidance, some good tips, resources, but we'll have a specific town hall on mental health and wellness.
Very good. A few questions that are coming into the chat as well are around outdoor activities, or providing some of these spaces and heating up some spaces. Is that a possibility for this semester? Kind of cold right now.
So we are certainly looking at that. The tents that we had up in the fall were not rated to support snow, and so we had to take them down. But we left the structures up because as soon as the risk of snow declines, we're looking to recreate those tents and looking at other options, other possibilities in terms of outdoor spaces. It's certainly the case that evidence is very strong that outdoor activity is much lower risk than indoor activity. And so we want to encourage outdoor activity as much as possible. I know it's cold, but I think that if you want to do something that's relatively safe, take a break, get some exercise, doing it outside is definitely a safe way to go. And so I would certainly encourage that.
Good. Another question that's coming into the chat is, several questions coming about the dining areas. How are decisions made about which dining areas remain open, and perhaps about why there aren't more of them that were open, particularly down around the classroom?
Well, it's clear from not just from colleges and universities, but from studies that have been done across the country that in-person dining, especially indoor in-person dining, is an activity that is higher risk, and that's why, despite the fact that it has caused significant economic concerns, in-person dining has been one of the things that's been completely shut down or largely shut down in many parts of the country at different times. I know that many places are restoring it, but it is still one of the riskier activities, and certainly one of the riskier activities that would occur on our campus. And so that's why we have moved to a system of grab and go, pick up and take it somewhere else to eat. That's the current system, and that is something we would like to be able to relax if case counts come down. And there also were some questions about the idea of allowing students who are in quarantine to go and pick up food. Given the numbers of students who are in quarantine, the ability to deliver food and the logistics of delivering food were very difficult. And so we looked at the question of how could we do grab and go dining in a way that would be with minimal risk. And so the system that's been put in place, which has been evaluated in a number of different ways, is a system that we believe to be reducing or minimizing the possibility of any kind of contact that would allow for transmission of the virus. We believe that the grab and go dining, even though it does involve some people who are under quarantine, is something that we believe to be safe.
Good. So some of the questions also coming in are how can students be more involved, perhaps either in the information or perhaps even in decision making? Has there been any discussion about allowing students representatives on the COVID response team?
So we have shifted, as I mentioned at the beginning, we shifted to have one of the CRT meetings per week have both undergraduate student and graduate student representatives at that meeting, in addition to a representative from faculty senate and one from staff. If we're happy to connect with other groups of students, we would, either by email or through other means, I would say that you can certainly work through student senate, either undergraduate or graduate student senate. If you have other thoughts or suggestions, feel free. I think probably the best place to send email is to the in-COVID email, and then that'll get filtered and sent to the appropriate place. But we are certainly looking for suggestions, looking for thoughts and ideas.
Is there any way for a student to get even more discrete information, like a number of positive cases in my dorm room or my dorm building or something like that?
Yeah, we've looked at some options to try and provide more detailed information. It is always a bit of a trade-off with privacy. We're dealing with medical health information, and so there are privacy concerns that come up when we're asked to provide more granular information. The idea that somebody could be identified as someone who has COVID or had COVID, et cetera, is something that is a significant concern. So we get sort of pushed in both directions on this issue as to how much information we should be making available. So that's the line that we're trying to walk, and trying to provide information in a way that allows people to make use of it without revealing the health status of any.
Yeah, I would just add to that too, like even with the residence halls, even over the weekend, they're also informed, like if there are positive cases over the weekend, there is a direct connection to housing services, and they're able to relocate students as needed, even over the weekend. So that's a long way of saying that the people that need to know imminently are able to get that information to keep the campus safe.
We realize that there's a lot of activity. We've heard at times that it's hard to get an appointment at the Health and Wellness Center. How should that be handled?
Sorry, Chris, I didn't hear the question.
If there's trouble getting an appointment at the Health and Wellness Center, what should a student do? We've heard that sometimes there's so many students coming in that it's hard to get an appointment.
Sure. So, well, there's really three different options. So one is we actually are creating a different phone tree in the Health and Wellness Center as we speak, actually, and it's going to be it's queued. So in other words, there isn't any reason that you shouldn't be able to finally talk to someone in the Health and Wellness Center. You're going to have students will have the opportunity to remain on the line, and the call will be answered next versus the phone ringing. So I'm really happy about that, because it just means that just hang on the line and we will get to you. Of course, you know, there are times where we have high volume, but we will get to you. So if you hang on the line, we'll get to you. The other thing that you can do, you can also email us, email the Health and Wellness Center, and we monitor that frequently. And you can also email me too.
Yeah, an effective way to also reach us is through the electronic health record secure messaging portal. And then you can send a specific question to us. And we do our best to keep, you know, track of that and respond to students. The other is if it's after hours or weekend, we do have a relationship with Lehigh Valley Health Network, and students can call the 24/7 nurse line and be directed to testing. And that testing would be at one of their express cares where they do the testing. It's not the rapid testing, so students need to understand it's not immediate testing when you get there, but they do the testing. Current test turnaround times seem to be in the 2-day-ish range, which isn't too bad compared to what we've seen at times during the pandemic.
And I would just add to what Dr. Stevens said just a minute ago. What we find mostly when students call the Health and Wellness Center, they do have a specific question that pertains to them. And so uploading that question on the patient portal in the Health and Wellness Center is probably the best and most efficient way to actually get an answer to your question.
Okay. So we've got a lot of plans for this semester. Anybody want to look in your crystal ball and tell us what the fall might look like?
I wish I had a crystal ball, but I'll take a stab in any case. I mean, I will say that I'm relatively optimistic. I think that if we look at the rates of vaccination, you know, vaccines should be widely available by mid to late summer. If we, you know, there are some concerns about vaccines and some of the variants that have emerged, and some vaccines being more or less effective against some of those variants. I think that is something that certainly is a concern, and I think it's something that we will figure out how to manage I mean, there are something like worldwide, something like a dozen vaccines that are in various stages of approval. I think that diversity of vaccines will actually be helpful when it comes to variants. And I also think that as more and more people get vaccinated, the case count will come down. You know, one of the conditions in which these variants that may be vaccine resistant emerge is when there are lots of cases in the environment, in the community. And so I think, you know, we want to try and keep case counts low so that there are fewer opportunities to generate variants that may be vaccine resistant. But I'm relatively optimistic that over the course of the summer, we'll see rates go very low, and that given the efficacy of some of the vaccines that are out there, the Pfizer and Moderna vaccines are highly, highly effective, much better than I would have predicted even a few months ago we would be seeing. So I'm optimistic that once vaccine availability becomes better, we will be in a good place going forward, you know, for the fall. But the one thing that that I think we've all learned in this pandemic is that things can be unpredictable, and so I think we need to wait and see. But I'm relatively optimistic about the future of vaccination.
I would share that optimism. I think just as Dr. Urban was saying, the availability and the organization of the distribution of the vaccine is going to be key. And assuming that really improves over the course of the spring and early summer, assuming that happened, we should see case numbers fall. And that would just be terrific. I think so I absolutely share that optimism. I think that's going to be key, though, is really getting that vaccine out there and distributed to the public.
And so, you know, what really, that part of what that says to me is that the critical time is the next few months. That if we can sort of manage things and get case counts down and get sort of positivity rates down, then as the vaccine availability goes up, we will be in a much better place. And so I think we really have to do the hard work to make sure that we can be safe and get the case counts down so that we can be as open and as in-person as possible over the next few months. And then the vaccine availability, vaccine prevalence will start to sort of take effect, and we'll begin to see those case counts go down.
All right, very good. We're running, well, we're pretty much out of time, but there is one prediction that came in over the chat. So I wanted to read this one maybe as our last question. It seems likely that the positivity rate is not going to go down this week. In that case, what are the next steps?
Yeah, great question. And I would agree that these, given the time lag associated from exposure to positivity to getting test results back, et cetera, it's not going to respond very quickly no matter what we do. And so we are looking, and the COVID response team meets pretty much every day, and we will be looking at what options we have to adjust the level of activity, the posture and status of campus. So we'll continue to look at that. And we've talked about some of the kinds of things that we are looking at. And we're always trying to do that guided by what we know from our own experience, from our own data, and from other institutions about what are what things are safe and what things are more safe and less safe. And so we will continue down that path. But we're certainly monitoring closely and trying to assess what kind of adjustments we need to make.
Great. All right. We're gonna close with that. I want to remind people, we know that we didn't answer all the questions that came in. We're going to keep a log of those. We're going to look for other avenues to answer those and be working with some of the student leaders about those questions. Before we close, Nathan, any final words you'd like to put out there?
Well, I would just, I'd like to, first of all, thank everybody for participating, and also give a special thanks to all the people who have been involved in the testing operation, and the contact tracing operation. There are more than 100 volunteers who have stepped up to provide different aspects of that operation. And this has gone from being something in the fall that was an occasional event to being something that is an everyday activity. It's routine now, or soon will be. But in order to do that, it really took a lot of people being willing to volunteer their time to shift what it is that they do in order to have these operations, these critical operations, function. And so, really thanks to all those people, and thanks to all the students who are trying to do the right thing and trying to be safe and follow our rules and guidelines through this difficult time. I know that it's a difficult time, and we want to try and reduce the positivity rate, reduce the case count, so that we can move into a more normal section of this semester.
Right.
Thanks, everyone.
Thank you. Thank you, Dr. Urban. Thank you to all of our panelists. We appreciate that. We're glad everyone could join who did join. Remember that this is recorded. If you want to go back to it, it'll be on the information site. And be safe and be well, and we'll talk to you soon. Thank you all. Bye-bye.